we are going to develop our understanding of intra-abdominal pressure. So we've already talked about the core as a cylinder, and hopefully this will start to explain why we spent so much time learning about the pelvic floor and the diaphragm. Our core is like a cylinder in that there is a pressure inside it compared to outside it, and our skin and muscles create the outside barrier between the inside pressure and the outside pressure. That means when we move a wall, we change the pressure inside the vessel and it affects the other sides of the cylinder. For example, when we breathe in, we're moving our diaphragm down as it flattens and contracts, which increases the pressure inside the cylinder. The pressure has to go somewhere, so we'll push on our stomach and pelvic floor. This is why you might see your stomach expand when you breathe. A more extreme version of this is when we do an ab exercise, like a crunch. We're going to push into our stomach and make it smaller, which means that pressure has to either come up through our diaphragm or down through our pelvic floor. When our muscles are strong, we have the force to resist this. So typically our pelvic floor muscle, for example, will contract up against that crunch to keep the pelvic floor in place and continent. However, with diastasis, we have a new weakest point, our linea alba. With diastasis, now when we perform a crunch or abdominal exercise, we might find that increased intra-abdominal pressure is pushing out through the linea alba, causing doming or coning. So what does coning and doming look like? It is where the front of the stomach starts to come up or out when you do things like an abdominal exercise or anything that increases intra-abdominal pressure. This could also be something like a cough or sneeze. In practice, when we crunch up like in this video, you can see that we're squeezing that cylinder smaller and therefore increasing intra-abdominal pressure. From here, we're going to learn how to use breath to regulate that intra-abdominal pressure.